Hello everyone, myself Sakshi Pal. I am student of physiotherapy of second year at Marwadi University. Today we'll be discussing a topic of psychiatry. The name of the topic is schizoid personality. So basically, schizoid personality is a mental health disorder. The people suffering from schizoid personality basically suffer from the episodes of detachment. They have very little desire to develop any relationship or friendship with other people. These kind of people prefer to stay alone, work alone, or any kind of activity that which they like. They prefer to do it alone. So now we'll see what is schizoid personality. So the core characterizations of schizoid personality is basically it comes under the cluster A of the personality disorder. It is characterized by persistent detachment from social relationship. It also markedly restricted range of expression of emotions in interpersonal settings. Individuals generally do not desire, enjoy close relationship bonds, including family relationships. So basically, we have three personality disorder clusters. First one is cluster A, which is odd and eccentric, in which schizoid, which includes social detachment and flat affect, paranoid, pervasive distrust and suspicion of others, schizotypal, cognitive distortion and odd behavior. Schizoid personality disorder comes under this cluster. Next, we have cluster B and C. Cluster B includes the individual having dramatic, emotional, erratic personalities. Cluster C includes people having anxious and fearful personality. Next, what are the etiology or causes of schizoid personality disorder? Basically, the causes are biopsychosocial influences, which includes biological factors, psychological dynamics, and environmental aspects. In biological factor, clear genetic overlaps and increased prevalence in relatives of patients with schizophrenia. Next is psychological dynamics. It is usually associated with cold, neglectful, or emotionally unsupportive parents during their upbringing. Next is environmental aspect. Environmental aspects include social deprivation or extreme isolation in childhood. Next is the development pathophysiology of this personality disorder. So basically, this includes neurological genetic compromise and psychosocial compromise. In genetical compromise, researchers point towards that the people suffering from this personality usually have affection in their dopamine system. The dopamine of this individual is not released properly, which affects their mood and forces them or makes them to stay alone. Psychosocial compromise, a critical failure during early emotional attachment development leads to withdrawal as a protective behavioral shield. Next, the core clinical features. So basically, the people suffering from this personality disorder shows features like they prefer to have solitary lifestyle. They usually emotionally they are very cold towards everybody and they prefer to be alone. Their behavioral profile, like how their behavior is, often described as extremely quiet and aloof and withdrawn, speaks in monotonous tone, they are not very lively in speaking, with lack of active non-verbal gestures. Like they don't do hand gestures, they are just sitting straight, they'll not even make eye contact, they'll just speak monotonously, no livelihood, anything, nothing. Minimizes interpersonal friction by staying away from group tasks. Basically, they avoid group settings. Next is diagnostic criteria. This is the diagnostic tool which helps to assess the personality disorder individuals. Now, basically, personality disorder is a mental health disorder. It is often misdiagnosed or confused with other personality disorders such as autism, avoidant personality, and schizophrenia. In autism spectrum disorder, unlike ASD, individuals with SPD show normal social cognition and language skills but have zero interest and desire to have relationships. Next is avoidant personality disorder. It is often driven by extreme fear of rejection, low self-esteem where SPD has no desire to develop relationships. Last one is schizophrenia. SPD lacks persistent active positive psychotic features like hallucination and delusions. Next, this is the clinical management, how we can help the individual suffering from schizoid personality. Next is gradual rapport building, which includes you build trust with that patient. Next is respect autonomy. Don't force them to open up on the first day. Next is graduated social introduction. Keep them stress free. Last is family psychoeducation. Treat their family and how to treat or look at them. Then this is the evidence-based treatment, psychotherapy and pharmacological treatment, which includes medicines and cognitive behavior therapy, social skill training and supportive therapy. Implication, what a physiotherapist can do for the people suffering from this disorder. So strategies for physiotherapists are respect personal space, don't interfere in their personal space, just respect their personal space. Clear and focused instructions, individual session. They usually prefer one-to-one session therapies. They avoid group discussions. So, and this is a real life case scenario where a person who is suffering from schizoid personality disorder, which comes for physical training, if you read it, you can make out how a person is suffering from this disorder, and this is the approach how we can treat that patient. Thank you.